So second and third trimester complications that you could see are placenta previa and placenta abruption. Again, we talked about the importance of the placenta. It's acting as the lifeline for the fetus. So it's acting as its liver, it's acting as its lungs, it's acting as, gas exchange. It's helping prevent, infection, sort of protecting it from mom's immune system. So the placenta really is the lifeline. So when you have issues with that, you have to think about, how it's going to affect your fetus. And, you have to think about, at what point in the pregnancy, an issue is happening and what is happening. So with previa, what that means is there's an abnormal implantation of the placenta. So it's implanted in the lower uterine segment as opposed to higher and up on one side. It happens in about 1 to 200 pregnancies. And how a patient is going to present most commonly is they're going to have painless, bright red bleeding. Because of small disruptions in the placental attachment and stretching and thinning of that lower uterine segment, you're going to see bleeding, but there's not necessarily going to be any pain for your patient. The placenta doesn't really grow with time, but it does sort of migrate up and off the cervix. So you can have a placenta previa early on in pregnancy, and it can sort of migrate towards that blood flow. Many times if patients have a placenta previa at their first ultrasound at 18 or 20 weeks, they might be provided with information on bed rest or pelvic rest, and then sometimes that placenta will migrate up and out of the way. We'll talk about on the next slide, if it doesn't, how you're going to care for your patient. But it is possible for a placenta previa or a lower placenta to sort of migrate out of the way. Placenta previa just means placenta before. So instead of the placenta being sort of up here where you want it to be, it's down here covering the cervix. So you can imagine if that happened, completely, and it was, 36, 37 weeks, that's not going to be a vaginal birth because that placenta is in the way of the fetus coming out. So it depends on where you are in your pregnancy when you realize a previa is happening, what your treatment's going to be. So again, risk factors are a scarred uterus, so people that have had C-sections or previous abortions with cutting, they are at higher risk for placenta previa because of that abnormal implantation. Smoking, cocaine use, if you have a history of previa because of this vasoconstriction, and maternal age over 40 are all risk factors. So most of these women, they'll have a non-stress test, which is where they're put on the monitor for 20 minutes. They'll see how the baby is reacting to any kind of contractions. If she's actively bleeding, there's going to be, IV fluids, a lab workup, ROGAM's going to be given, again, bed rest and electronic fetal monitoring. Betamethasone would be given to promote fetal lung maturity if the baby is preterm, so if you're less than 37 weeks. If there's life-threatening maternal hemorrhage, there's so much bleeding, or labor can't be stopped, labor started and it can't be stopped, or there's signs of fetal compromise once you put the fetus on the heart tones and that doesn't look good, then they would do immediate delivery. Your education that you really want to know is that you're not going to do a vaginal exam to make any sort of bleeding worse as a nurse, and you're also going to teach patients the importance of reporting bleeding in pregnancy. So for the most part, bleeding in pregnancy is not a normal finding. It's always something that they want to report. And as a nurse, she has painless bright red bleeding. She comes in, she's 26, 27 weeks. You're not going to be the one that's giving her a vaginal exam to make that bleeding worse. So those are your takeaways. So again, this is just sort of showing you, so A is a complete previa, so the placenta is completely covering that cervix. B is a partial, so, that could migrate, it depends, and marginal or low-lying just means it's within 2 centimeters of that cervix. So, depending on, at what point you are, how pregnant you are, this baby's obviously not going to be born vaginally. This baby, if you had a few weeks and the placenta does migrate, possibly can be born vaginally. It just depends on where you are in the pregnancy and how much of the cervix is being covered by that placenta.